Greetings and salutations one and all. Welcome to the night shift. It's Healthy Love Night right here on the night shift with DJ Kevin Stew. How's your Tuesday? Yeah, man, fling it.
Give me the girl who come to give the kind of wine to remember. The kind of girl who come to play so you can't call she no pretender.
Kerwin Dubois,
I love
voice, Teddyson John, and lyrical.
I don't care who watching on, cause I just wanna wind up your body one.
The track is called Speechless.
Mac again like we get a encore. Press on your body like a piano. I want you give me more and more. Wind up your body 1 foot off the floor.
Wanna say big up to everybody locked in right now.
Press on your body like a piano. I want you give me more.
Those tuning in on TuneIn Radio. The night shift to DJ Kevin Stew. Those locked in on One Harmony Radio to the UK. Top of the morning to you. Those on ClintonLindsay.com, the Foundation Radio Network. Big ups to you. If you're locked in on WGLRO, home of the Donnie Walker Morning Show. Enough respect to you. Yeah man, fling the bumper. Yeah man, do it. No shame. Wanna say big ups to those on Island Worldwide out of NYC. And their neighbors NIE Radio over there in New Jersey. Those listening on Island Worldwide just finished tuning into Gary. Come on, the big boss, the real boss, yeah? Only answer to the bigger boss. I
don't know what to say.
Wanna say big ups to those who on PEMGTV.com.
Fling bumper, say wine and go down like that, go down like that. Give me the girl who come to give the kind of wine to remember.
Those of you who are just meeting me for the first time, my name is DJ Kevin Stew. And this is the night shift. Every Tuesday we do a thing we call Healthy Love.
I don't care who watching on, cause I just wanna wind up your body 1 foot off the floor. Come back again like we get a encore. Press on your body like a piano. I want you give me more and more. Wind up your body 1 foot off the floor. Come back again like we get a encore. Press on your body like a piano. I want you give me more and more. Girl, you're more than a million, billion, a million. You should be a billionaire. The way you whine and you put it down, yeah, yeah, yeah. I want you give me a chance, girl. You see, I don't know what to say. Yeah. I'm speechless, baby. Nothing you do, I go regret, baby. Yeah. I don't know what to say. I'm speechless, baby. All the man show you respect, baby. Yeah. Could be the way you drop on. Fling bumpers.
Did I leave him speechless, China?
Don't like that. Don't like that. Fling bumpers, wine and go down like that.
Big up to China Nicole.
Baby, I want you to be my ride or die. I wanna treat you just like you could be my future wife. I wanna hold on your hips so. Come let me wine and go dip so. Give you a kiss and the lips so. Be my ride or die. Wind up your body 1 foot off the floor. Come back again like we get a encore.
Wanna say big ups to those who are locked in on Facebook Live.
I want you give me more and more. Wind up your body 1 foot off the floor. Come back again like we get a encore. Press on your body like a piano. I want you give. I don't know what to say. I'm speechless, baby. Nothing you do, I go regret, baby. Yeah. I don't know what to say.
Remember, the Facebook Live is not the entire broadcast, it's just a segment. So I invite you to call a friend, tell a friend. Call your enemies, friends of your enemies and enemies of your friends. Tell them all, come in. So, there's a video that have been filmed. Well, it is said to have been filmed in Shijiazhuang. That's the name, right? Shijiazhuang in China. Now, for those of you who are from China, don't kill me for massacring your city's name, but I did the best. It's Shijiazhuang, China. Now, there's apparently a video that had been filmed from that city that showed people walking with a little bit of a waddle as they left a hospital. I wonder why. And presumably it is because they had just received the new anal swab test for COVID-19. Yeah, you heard right. Before I go any further in trying to get to the bottom of this information here, I want to say thank you to my segment sponsor, Pulse Media Group. When being in a moment is priceless, give them a call for innovative streaming and recording solutions. They do everything you see right here on kevinstew.com. That what you see on Pulse Media Group, on PEMGTV.com. They do all those things and a whole lot more. So call them up, and the number is 754-999-6020. Check them out online, pulseemg.com. See what I can do for you. If you have an event that you want to stream live, if you have a seminar, a wedding, a funeral, graduation, you name it, call them up. Let's see what they got that they can do for you, and just tell them DJ Kevin Stew sent you. All right, cool. So thank you, Pulse, for sponsoring this segment. Now, once again, if you're just tuning in, this is Healthy Love, and so we're trying to get to the bottom of this information here. The Shijiazhuang Internet Report Center said the video was fake, and it's since been taken down, but not before millions of people viewed it. Did you see it? I didn't. So that would be two of us that missed out on that little bit of a, I don't know. Yeah, I guess some of the creative people in this world could put that video to music. Now, while the image of people waddling like penguins after an anal swab might be a bit of an exaggeration, what is not fake is actually the anal swab test for COVID-19. It's a real thing. Who knew? I didn't. Released in Beijing, the test is said to be more accurate than the previous methods for detecting the virus. And I don't know, that kind of just leaves me with a puzzled look on my face. According to Forbes, Li Tongzheng, Deputy Director of the Respiratory and Infectious Diseases Department at Beijing Yuan Hospital, cited research that SARS-CoV-2, the virus that causes COVID-19, survives longer in the anus and feces than in the respiratory tract. And due to this, an anal swab may be able to more accurately detect mild or asymptomatic cases than a nose or throat test. Whew. Yeah, it's a little bit hard to really get a grasp of this one. While the tests are said to be only for high-risk cases, they've reportedly been given to unsuspecting individuals. including travelers arriving in Beijing, those in quarantine centers, and even 1,000 children and teachers who were exposed to the virus. So, let me try to understand initially how this ends up happening to unsuspecting patients. Right? That's what I said. Unsuspecting individuals. Let's not say patients, because they haven't been admitted to any medical facility. So you go in to get your COVID test, and instead of hearing, okay, open wide and say, they're telling you to open wide and bend over. How exactly did the setup for this test, how did that go? How did that conversation where you were filling out the paperwork saying that, okay, I'm here to get my COVID test, what was the response that was given to the person that was there to do their test? I'm oof. Anybody else bothered by this? Even slightly? Numbers to call, numbers to text to share your views. 773-789-STEW, 773-789-7839. Call, text, WhatsApp, Telegram. You can Skype me if you're overseas and want to share your views. Kevin.stew is my Skype handle. Really easy. And of course, you're encouraged to jump into the chat. You can use the link on the Facebook Live post. You can go to kevinstew.com. It will forward you to Pulse eMedia's PEMGTV.com. And again, thank you to Pulse eMedia for the temporary resting place where people can view the broadcast. Because, you normally watch on kevinstew.com, but they're doing some work with kevinstew.com right now, rectifying some problems, and all being well, we'll be bigger, better, badder than before. Yeah? Cool. All in a good way. So, in a poll on Chinese social media website, Weibo, 80% of who responded said they could not accept anal swab testing for COVID-19. While the test can be performed from a stool sample submitted by the patient, it is not possible to test. The test involves inserting. If that's not possible, the test involves inserting a cotton-tipped swab 1 to 2 inches into the rectum. 1 to 2 inches. So that's about up to your knuckle from your fingertip, right? Just about. Yeah. Okay. So the information, as according to Mercola.com, goes on to say, quote, if we add anal swab testing, it can raise our rate of identifying infected patients. Tong Zhen was reported as saying on state-run news channel CCTV. But of course, considering that collecting anal swabs is not as convenient as throat swabs, at the moment, only key groups such as those in quarantine receive both. Again, how does that discussion happen? Those in the medical field, I'd greatly appreciate love if you could help me out with that one, because that's a big pill to swallow. And I don't know how many people are trying to swallow that pill right now. Hey, you're getting not just the discomfort of a nose and throat swab, but also of a rectal swab. One Chinese study published in Future Medicine in August 2020 reported that in some patients, anal swab tested positive for SARS-CoV-2, while the virus was not detected in throat swabs or septum swabs. Sorry, sputum swabs. They concluded anal swabs might be the optimal specimen for SARS-CoV-2 detection to evaluate the hospital discharge of COVID-19 patients, although the study was limited in that it involved only 4 patients. 4. So, are they then saying that the regular test, the PCR test, the nose and sputum test, not that accurate? And well, okay, so let me not try to play devil's advocate, considering that I've been talking about presenting information about that test, that PCR test, for a while now. So talk to me. How does that how do we navigate this whole thing? Another study conducted by researchers at the University of Nairobi, Kenya, suggested that SARS-CoV-2 may be shed through the gastrointestinal tract via feces. They analyzed literature to determine if the virus may persist in stool even after a negative nasopharyngeal test. In a review of 12 studies, they found 107 cases in which a positive rectal, anal, or stool SARS-CoV test was positive after a nasopharyngeal test was negative. So, a lot of people that tested negative were really positive? And, or does it mean then that those that tested positive were really positive, those that tested negative, their viral load was so low that it could only be detected in the feces? I'm so confused. Therefore, the article the article goes on. Therefore, they noted there is some evidence of the persistence of SARS-CoV-2 in the body secretion in convalescing COVID-19 patients. It is noteworthy that a significant portion of these patients are within the pediatric age group. In a BMJ Rapid Response article, Dr. Arturo Tosi, a pediatrician with the University of North Texas, suggested fecal excretion of SARS-CoV-2 may persist for 1 to 11 days after excretion in sputum in 23 to 82% of adults. He suggested rectal swabs could be used to test patients with COVID-19 symptoms or known COVID-19 exposure who test negative via throat or sputum tests. He further stated, quote, "Indeed, the available data suggests that some patients test positive on rectal swabs in the very first days of COVID-19 onset." To make a few examples, in a review article, reported fecal PCR positivity 2 to 5 days after sputum in 36 to 53% of patients, while Zhao et al. In 2020 found that 39 out of 73 hospitalized patients had viral RNA in their feces from 1 to 12 days. Therefore, the occurrence of orofecal root points. The occurrence of orofecal root points towards the usefulness of rectal swabs at the very onset of the disease to confirm or even diagnose COVID-19. So, does that now mean that we face another challenge? Hey Joy, how you doing? So, comment here. You know that the test they use is the same test they created to prove that you can carry HIV without it becoming AIDS. They run this test 9 times. The test can come back negative 8 times, but if on the ninth time it is positive, then they say you are positive. So it is run that many times because they're unsure, or it is run that many times because they're looking for a positive. And again, the PCR test is, they modify or amplify, not modify, they amplify that bit of a sample that they take from you so many times that even a dead or dormant virus could be seen as a positive result. So, how accurate is this anyway? Time will tell whether anal swabs become more popular for COVID-19 testing in China and around the world. For now, it is still generating snickers among European Commission spokespeople, but when asked by a journalist whether anal swabs could be implemented for the European Union, were the European Union-wide testing for COVID, a spokesperson said they would follow the medicine. Follow it where? European Commission spokesperson for Health, Food and Safety and Transport, Stefan de Kersmaker, said, "We will go where the science takes us. So if the science takes us to the butt, we will consider this. But of course, I don't think I can add a lot on this. We indeed rely heavily on the input from scientists, and so we leave it to the scientific world to see what are the best approaches." End quote. There are critics among the critics of the anal testing as well. And Forbes reported that Yang Zhanqi or Zhanqiu, the U is after the I. So Yang Zhanqiu, a pathology expert from Wuhan University, told China's Global Times that nose and throat swabs were most efficient, adding, quote, "There have been cases concerning the coronavirus testing positive in a patient's excrement, but no evidence has suggested it had been transmitted through one's digestive system." So, that means what? There is proof that the virus is in the body, but no proof that it can be transmitted to someone else if it is in the feces? What does that mean? Dr. Amesh A. Adalja, senior scholar at the Johns Hopkins Center for Health Security in Maryland, also raised concerns about the nature of the testing, telling Health that not only is it unknown whether anal swabs are useful for detecting contagious cases, but, quote, "I also worry that such messages may discourage people from getting tested. For most purposes, including screening asymptomatic individuals, nasal or saliva samples are sufficient." Submitting stool samples would be one way of getting around the unpleasantness of the test, as stool samples are already collected for a variety of other medical tests, according to Joanne Santini, professor of microbiology at University College London. She told Insider that anal swabs are, quote, "the obvious thing to do," according to Insider. Quote, Santini explained that the virus attaches to the human body using a receptor called ACE2, and there are many ACE2 receptors in the gut. The viral load, the amount of virus shedded, can also be higher in the feces, especially if someone is suffering from gastrointestinal problems caused by coronavirus. And viral shedding can last for longer in the feces than in the sputum. even though a common way of being infected is through respiration, I think there must be some infection happening through the gut via the mouth, she said. So, okay. There's evidence that SARS-CoV-2 in feces is infectious, just like other viruses, such as norovirus and other coronaviruses. All right, so if they can test it in the feces, why do they need to stick a swab up your butt? That is where I'm resting at for now. That message here on Facebook, it's run that many times to create the amplification. This gives the drive up testing a whole new outlook. Yes, listen, and this is what I was saying at the beginning, Joy. You know, how does this affect people who are doing their drive up testing? You know, okay, here I am. I'm coming to do my test, and they're telling you, okay, instead of opening wide and saying they're telling you to bend over this table, spread them wide, and cough. I don't know, but 2 inches. It's a 2-inch swab, 2 inches inside the rectum to do this test. That could be a little bit uncomfortable, but again, if it is a regular cotton swab, you know, maybe it's not that uncomfortable. I don't know. Personally, I don't want it. I don't. This is like going to a proctologist to have them check your feet. 773-789-STEW gets you in touch. 773-789-7839. We're gonna take a quick little break. When we come back, we continue with some more information. What say you? How do you feel about this whole idea of a rectal exam to test for coronaviruses? The moment I came across this information, I felt a little bit uneasy. You know, it's it just seems invasive. We're gonna take a quick break. Thank you guys over there on Facebook Live. We'll be saying sayonara to you guys. Come on over. Use the link that is pinned in the description in the comment section. If you're just tuning in, welcome. Call a friend, tell a friend, share with a friend, or an enemy. Friends of your friends, friends of your enemies, and enemies of your friends. Get them all. It's Healthy Love Night right here on the Night Shift of DJ Kevin Stew. Come on over. Join me in the chat room on Paul C Media Group, PEMGTV.com. All right. You can use the same Kevin Stew link. It has been forwarded to PEMGTV temporarily. All right. Cool. We'll be right back.
Paul C Media Group, innovative streaming and recording, has done it again. A new way to get your business in full view of your neighborhood consumer through AdShare TV. It's available in your neighborhood today. It's easy. Just call us 754-999-6020. Become a host today and place a TV monitor in a strategic location so it's easy to see. Get a 1-minute video ad or longer that plays anywhere in our network. Can't be a host? No problem. For a few dollars, we'll run your 30-second video ad. A host can run announcement specials like buy one get one free or discount ads. Let's turn your flyers into a 30-second video with music or a voiceover, or let us create and run your video ad with a spokesperson. Take advantage of our early enrollment discount. Join us today. Your ad will be seen at least 30 times per day in your AdShare TV neighborhood. It's easy. Just call us 754-999-6020. AdShare TV, part of Pulse Media Group.
It takes an entire village to raise a child. Hello, I'm Paul Campbell, here to talk about Palace. Peace and Love Academic Scholarship. This non-profit group supports students facing serious obstacles from entering or continuing their studies, not because the grades are failing, but due to the lack of financial support.
Over the past 8 years, Palace has awarded 600 scholarships valued at approximately 50.3 million Jamaican dollars, or 415,000 US dollars.
Together, we must build a better future for our children. Please visit www.palace1.org and make your donation to brighten the future of a deserving child. Palace, preserving young minds for posterity.
A social distancing tip.
While the CDC urges you to avoid close contact, like hugging or shaking hands, there are other non-physical ways to say hello. Wave, wink, use sign language, salute, smile, give the peace sign, throw up an air high five, do jazz hands. Remember, stay a minimum of 6 feet or 2 arms length away from others, and stay home if you can. For more info, visit coronavirus.gov.
Let's all do our part, because we're all #AloneTogether. Brought to you by the Ad Council.
Matthew 28:19 says, "Go ye therefore and teach all nations." With this in mind, and encouragement received during a South Florida media conference, The Church Links was birthed. The Church Links is an interdenominational worship service portal for churches, providing the tools to spread the word through technology in a cost-effective way. The Church Links, www.dahchurchlinx.com. Your links to worship and praise.
Hey, I'm representing for DJ Kevin's Jew, working on the night shift radio show. Won't go changing like the weather, just to please the devil never. Will DJ Kevin's Jew sell his soul? That's a word and honor. It's Christine representing word and honor. Selassie DJ Kevin's Jew.
Been a long time coming. Are you ever gonna change? Are you ever gonna to take advice for how I'm feeling? It's been a long time running, and I know you wanna stay. So I think that it is time we live like we used to. Right all around the city, singing with the top down. Let's take it back to when we were younger. It's been a long time coming, so put on a happy face. Grab my hand so we can let all of our troubles out. There's no cares tonight. Take me for a ride. Even when it's dark, never will lie. Even when it's dark and you lose your mind. Oh, right in the moment when your head is confused. Oh, I will stay in the mind of you. Na 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 na.
I'm crazy too. The sound of Royce. The track is called Madness. I want to welcome you back to the broadcast. It's Healthy Love right here on Night Shift with DJ Kevin Steele. I want to say thank you to Althea and her Healing Heavenly Hands for sponsoring this segment of the broadcast. Althea is user licensed massage therapist that comes to you with 20 years of experience, bringing her table, her oils, and of course her Healing Heavenly Hands. She comes to you COVID free and she'd like to leave that way. Give her a call, 954-655-9000, or email her at thealata@att.net. Outside of paying her, you know her one request, right? Get off her table and go sleep somewhere else. The track is called Madness. Joy says this is crazy. First they want to shove things up my nose. Now they want to shove things up my butt. Someone is sitting back somewhere having a good laugh. I really think they have a thing for orifices, Joy. You know, it's an orifice fixation. I don't know what else to call it. You know, where next? Where next? It remains to be seen whether anal COVID tests will catch on or not. But as it stands, positive reverse transcription polymerase chain reaction tests, the RT-PCR tests for COVID-19, well, they are the go-to, and they are plagued with problems. The PCR test is not designed to be used as a diagnostic tool, and as it cannot distinguish between inactive non-infectious viruses and live or reproductive ones. Let me say that again. The PCR test is not designed to be used as a diagnostic tool, as it cannot distinguish between inactive or non-infectious viruses and live or reproductive ones. Inactive and reproductive viruses are not interchangeable in terms of infectivity. If you have a non-reproductive virus in your body, you will not get sick from it, and you cannot spread it to others. Further, many, if not most, laboratories amplify the RNA collected far too many times, which results in healthy people testing positive for being ordered to take off work and self-isolate for 2 weeks from a false test. The higher the cycle threshold, the CT, that is, the number of amplification cycles used to detect RNA particles, the greater the chance of a false positive. While any CT over 35 is deemed scientifically unjustifiable, pay attention, the U.S. Food and Drug Administration and the U.S. Centers for Disease Control and Prevention recommend running PCR tests at a CT, ready for this, of 40. So your cycle threshold after 35 is deemed scientifically unjustifiable. But the PCR test is run at a cycle threshold of 40. A test known as the Corman-Drosten paper and tests... known as a Corman-Drosten paper and tests recommended by the World Health Organization are set to 45 cycles. And we thought the PCR test was bad. When labs use these excessive cycle thresholds, you clearly end up with a grossly overestimated number of positive tests. So, what are we really dealing with? It's basically a case-demic, which is an epidemic of false positives, versus a pandemic. The WHO updated its testing guidance. Not to say that the virus doesn't exist. I would never say that the virus doesn't exist. I know people who have had it and recovered. I know people who have had friends and family members that have had it and did not recover. They passed away. So, not to say that it's the virus that killed them. There was, who was it? I was speaking to somebody this past weekend, and there was a family member of theirs that went into the hospital with an underlying condition, contracted the coronavirus while there, and died. And they listed the death as COVID-19. So, you go figure. So, the WHO updated its testing guidance January 20, 2021 to admit that a positive PCR test alone does not equal infection, and that the PCR threshold needed to detect virus is inversely proportional to the patient's viral load. Therefore, in cases where the patient's symptoms do not correspond to the result of the test, that is, they're asymptomatic but test positive, they should be resting using the same or different. They should be retested using the same or different test. So, why use the same test? They also noted that the PCR test should only be used as an aid in diagnosis and not be relied upon by itself. Diagnosis must also include the observation of clinical symptoms. So, to get a diagnosis of COVID-19, you now need 2 positive tests if symptoms are absent, and a doctor's judgment call on whether symptoms appear consistent with a diagnosis of COVID-19. So, with the possibility that the doctors are being instructed to give these positive tests, with the probability of pushing a vaccine, y'all see where this is going? Yeah, call me conspiracy theorist. You know, I can do that. If you want to say something about me doing that, 773-789-STEW. 773-789-7839. If you want to say that I'm creating chaos, I'm provoking nervousness, well, isn't that what happens in the news anyway? I'm just putting a flip to it. I'm giving you the opposite of what the news is saying, and presenting that as a scenario. I'm not saying that is what it is. I'm just presenting it as a scenario. And then you can go from there and ask your questions, which you should be doing anyway, because again, my job is to stimulate your appetite and not satisfy your hunger. So whereas I tease you with this information, so to speak, you have a responsibility to take it a step further and ask further questions and seek out more information. I cannot see why you leave it just there. You know, to say, all right, that's the information I have, that's the information I'm going to run with, end of story. No. You need to do better than that. Because then you end up just being sheeple. If you want to be sheeple, that's fine. You can be sheeple. I'm just not the sheeple material. So, comment here. You notice, where is it? Oh, sorry, Joy. Here we go. You notice the flu and colds and any other communicable diseases seem to have gone on vacation. It would look that way, wouldn't it? But it's because the focus has not been on those viruses. The focus has been elsewhere. And, hey, if there's an agenda, there's an agenda. And I'm not mad at anybody that has an agenda. It's cool. Have your agenda. Do with it what you wish. Don't force it on me. But do with it as you wish. As you see fit. It's your agenda. No biggie. It is uncertain how many labs will adopt this advice to make their tests more accurate. That you don't just go with that one test and use it as gospel. The critique against PCR testing is further strengthened by a November 2020 study in Nature Communications, which found no viable virus in PCR positive cases. The study evaluated data from 9,865,404 residents of Wuhan, China, who had undergone PCR testing between May 14 and June 1 in 2020. A total of 300 tested positive but had no symptoms. Of the 34,424 people with a history of COVID-19, 107 tested positive a second time. Yet, when they did virus cultures on those 407 individuals who had tested positive, either for the first or second time, no live virus was found in any of them. How that go? It is unknown whether an anal swab may prove any different, but it is unlikely that most people will willingly submit to an anal swab over a nasal or throat test. I know that's not my go-to. Just me personally. Further, many are now questioning whether the faulty PCR test was rolled out on purpose in an effort to crash the global economy and provide cover for the implementation of what is known as a Great Reset. Well, that is another story altogether. Have you heard of the Great Reset? You can look up that yourself. Again, I'm just stimulating the appetite, not satisfying the hunger. So, are the anal swabs being seen as the way to go to test for COVID-19 or no? Because all we have basically are the PCR tests that we go off, or we're gonna go with the antibody test, which comes in the form of a blood test. So the argument is that the antibody test is going to say that you had a coronavirus, not necessarily COVID-19, and you had developed antibodies, but it doesn't say whether or not you have the virus that you can transmit it. But here's the thing: apparently, neither does the PCR test. So the PCR test says, yeah, he's positive or she's positive, but at the core of it, the PCR test itself is unreliable. So which test are we gonna go with? Is there any test that we can definitively say, hey, you know what? I trust this test, and when we get this test, then we know for sure that XYZ PQR, however it goes. The to date, I haven't been told any specific thing that I can go and get that test and say, okay, yay or nay, by way of the result of this test, because this test has been proven effective. Experts in the United States are questioning the use of anal swabs in China to detect COVID-19, according to Healthline.com. Researchers from the Faculty of Medicine of Chinese University of Hong Kong, CU Medicine, said they've found for the first time that people with COVID-19 have active and prolonged gut viral infection. All right, so how long is prolonged? And we know that gut health reflects optimal health. We know this. If you didn't know it before, you know it now. We've talked about it a few times on this particular broadcast on healthy love. So the fact that this virus is present in our guts, as it affects ACE2 receptors, which are dominant, are prevalent in our gut biome. What is being said. So then everybody should be doing stool samples to make sure that they're COVID free or COVID positive. So if that is the case, then let's get to it. Are there odorless containers that we're gonna be using to do this? How are we going to collect this fecal matter? Are we pooping on paper? Are we pooping on a stick? How are we doing it? Comment here in the chat. I don't know if it's the easiest way to go, but I do know some freaky friends of mine that will go for the test more than once. Why do they have to be freaky though, Joy? Listen, be nice to your friends. Why they gotta be freaky? Can't they just be looking out for their health? They don't have to be freaky to be going more than once. I know people that go several times for the regular test. They're not freaky. They don't like things being stuck up their noses and down their throats. They don't have those orifice fixations. Let me stop. They say the infections, according to healthline.com, they say the infections occur even in the absence of gastrointestinal symptoms and even after the respiratory infection has cleared. So they've been doing tests that state, so if the virus has cleared, right? If symptoms have gone away and now they're saying, oh, hey, yeah, symptoms have left, you are clear to go. Are they saying that even with the symptoms, you can still transmit the virus? Because this was still up in the air with the asymptomatic patients, the asymptomatic individuals, I should say, not patients. Strike that from the record. Yeah, so with the asymptomatic individuals, it was still not determined whether they transmit the virus, yes or no, because maybe their viral load is not that high. That is why they're not having symptoms. We don't know why people are asymptomatic. We just don't. So they say that the infections occur even in the absence of gastrointestinal symptoms and even after the respiratory infection has cleared. That means anal swab testing, which requires inserting a swab up to 2 inches into the rectum and rotating several times. I didn't include that in the beginning, in the first part, or the first time I mentioned it. It takes a freak to know a freak. You tell them several times, but okay, cool. As long as y'all know each other, that's cool. So where was I? That means anal swab testing, which requires inserting a swab up to 2 inches into the rectum and rotating several times, could detect COVID-19 cases that the standard nose and throat swabs wouldn't miss, according to the experts. Or does it? Pum pum pum. While the findings impact China's clinical management of COVID-19 patients, U.S. experts caution against taking the study or anal swab testing for the novel coronavirus seriously. Okay, so this is a big joke. They've done several tests and recognized that the virus stays dominant, stays active in the gut, and long after symptoms have gone away, that you can still have the virus that is active and dancing around in the gut, so it shows up in the feces. That means when you go to use a public restroom and you flush and you have fecal matter floating around in the air, the person that comes into the stall next could probably get it by way of this floating around fecal matter. What does that mean? Do we just grasp at straws? How do we put this thing to rest? Do we ever put this thing to rest? Is it just one cover-up after another? One story after another? One thing, whatever that thing may be, after another? What is it? How does it go? Where do we go from here? Who do we talk to? That's the other big question. Who do we talk to? Who do we listen to? You know, do we take the information we get on mass media and then go searching for other information? Or do we just take that information that we get on mass media and say, this is gospel, they have done their testing, these are the people that are professionals, they know what they're talking about, so we should listen to them because they wouldn't lead us astray. We should do that, right? No? What say you? I know. Me, Kevin Stew, and again, DJ Kevin Stew, not DR Kevin Stew. I am going to look for my information. I'm going to look for additional information. I'm going to look for information from different places. Because that's the other thing, you know. People in the United States tend to follow information that is only in the United States because they believe that the United States is the world. But there are other parts of the world too that this virus is there and their numbers are different from here in the United States. So what is happening in these other places and how are they dealing with it? In certain districts in California, let me read this. Let me see what you're saying here, Joy. In certain districts in California, they allow people to poop in the streets. Are you... What? Wait, what? Which districts would these be? And you're talking about California, the same California that is here in the United States? Just down on the West Coast over there? No, sir. Somebody please help me. Joy can't be serious. And, you know, I tend to trust the information that Joy gives me. She hasn't led me astray yet, but there's hope. Just the top of the hour, we're going to take a quick little break. When we come back, we see if we can break down this research a little bit more and wrap this all up in a neat little bow and flush it for the night and get into musical therapy. But until then, thank you, Althea, for sponsoring this previous segment. We're going to take another break. Okay, go ahead. Take that sip, get some water, get some more popcorn, get something and wave maybe, I don't know. But we're going to take a quick break and come back and chit-chat some more, wrap this all up in a neat little bow and call it a night. We'll be right back.
Imagine having our own Caribbean Center.
Imagine a museum highlighting our history and the contributions of Caribbean people to the world.
Imagine being able to visit and learn about the islands we call home
in a place where our kids can see and feel their cultural heritage. You can make this vision come to life.
Help us create this first-of-its-kind space
that all Caribbean people can be proud of. Your contribution to Island Space Caribbean Museum will help this dream come true.
Visit islandspacefl.org/GoFundMe.
Visit islandspacefl.org/GoFundMe.
Visit islandspacefl.org/GoFundMe and donate today.
When being in the moment is priceless, consider the ability to share that moment. If you can video it, you can broadcast it. And Pulse E-Media Group has the tools you need. Weddings, birthdays, funerals, graduations, church services, parties, seminars, you name it. Pulse E-Media Group can provide you with a secure medium controlled by you to broadcast your event. Contact us at www.pulseemediagroup.com for more information. Pulse E-Media Group, when being in the moment is priceless.
Come on, smile. Oh, honey, he's still not smiling.
Maybe he's not a smiler.
Yeah, maybe he's just not a happy baby.
Maybe he's just being a boy.
Or maybe he's teething.
Maybe it's just a phase.
Maybe he has autism, and we can definitely do something to help.
Maybe is all you need to find out more about autism. No big, joyful smiles by 6 months is one early sign. Learn the others at autismspeaks.org/signs. Brought to you by Autism Speaks and the Ad Council.
Greetings and salutations, one and all. You're invited to tune in to the Night Shift with DJ Kevin Stew. It airs on Mondays with Community and Finance, Tuesdays with Healthy Love, and Wednesdays with Real Talk from 10 p.m. to midnight Eastern Time. Come spend some time interacting in the stew pot where we keep things bubbling and wind down in musical therapy. The Night Shift with DJ Kevin Stew is on kevinstew.com, where you're encouraged to have acceptance through enlightenment.
Hey yo, this is Caramanti letting you know that right about now you are logged on to DJ Kevin Stew on the Night Shift. Don't move.
People are afraid, they are petrified. It have them lock up in a them house, them don't want to go outside. All of the clubs and pubs locked down, I can't even dance to my champion sound, but I stay strong. Ready for self-isolation, Sean. Now we're under attack, drones from out of space. So if you're going out, put gloves on, put a mask over your face. Me all I wrap up my dreadlocks and bring my cleansing cream with me. Maintain a good personal hygiene and stay 3 meters away from me. So I say go straight out the door. Coronavirus, you're not welcome anymore. Were you the one who tried to make me lay down and die? You think I'd grumble? You think I'd lay down and cry? I will survive. I will survive. Just as long as I know how to live, I know I'll stay alive. Clean out your house good, disinfect and sterilize. I've got my ceiling bang, domestos and my beer on by my side. Hope and pray the NHS don't fall apart. Big up the doctors and the nurses, we keep them in our thoughts. All those hours that them working just to keep people alive. Maximum respect due to all of you. My heart is full of pride. Now you see me say respect you. I'm not that selfish person in that supermarket queue. So if you feel like pushing past vulnerable people and I see all that anger that's inside, you don't want to upset me. So I say go straight out the door. Coronavirus, you're not welcome anymore. Were you the one who tried to hurt me with your lies? You think I'd grumble? You think I'd lay down and cry? Oh no, not I will survive. Yeah, as long as I know how to live, I know I will survive. People, clean out your house good, disinfect and sterilize. I've got my ceiling bang, domestos and my beer on by my side. So if just like me, you have lost good friends, and you don't know if it's corona or government and murder them. Hello? One thing I know, just make sure you not end up in a hospital. Me not go make no doctor joke me. Me not take no vaccination.
Our anal swab.
Straight out the door. Coronavirus,
I don't think Mikey Tough and the Friendly Fire Band knew about the anal swabs when they did this tune.
Fit and sterilize, I've got my ceiling bang. The Mr. Sun, my bedroom by my side.
Their rendition of I Will Survive.
Domestic abuse is on the increase because of all them dirty liars and them bedroom cheats.
Thank you for that information, Joy.
Them can't sneak out.
I wish it wasn't so.
All alone, so they keep texting, sending messages to your mobile phone. Your partner find out.
So in parts of Portland too?
Them sip your naked picture worse than.
No, Jamaicans, not Portland in Jamaica.
But just like Shaggy, you tell
Portland, Oregon.
wasn't me. No, you see all this corona causing your misery. So she say go sleep on the floor. As far as she's concerned.
Want to say thank you to my segment sponsor,
Anymore.
Reggae Global Entertainment.
She treat you like a king and a man, and just because
Reggae Global can handle your bookings,
something in
take care of your tour management,
go straight out,
take care of your business registration, legal service referrals, copyrights, music production, marketing and promotion, and so much more.
Were you the one who tried to make me lay down and die? You think I'd crumble?
You them a call 954-998-8034.
All those shopkeepers.
Or check them out online, reggaeglobalentertainment.com.
£1.99 is cheap on food.
Tell them DJ Kevin Stew sent you.
Now let me send out a little warning to all of them. I will send for all my friends, Steve, out your things and share with them. So I say go straight out the door. Coronavirus, you're not welcome anymore. Clean out your house good, disinfect and sterilize. I got my ceiling fan, the Mr. Sun, my bedroom by my side. I will survive, I will survive, yeah. As long as I know how to live, I know I'll stay alive. Hey, clean out your house good, disinfect and sterilize. I've got my ceiling fan, the Mr. Sun, my bedroom by my side. So I say go.
Mikey Tough and the Friendly Fire Band. I'm saying, go on, come out, go on, galang.
5 this week. Oh, now let me send out a little warning to all of them. I will
all them shopkeepers are robbing people
and share with them. So I
doing them price gouging.
Straight out the.
Speaking of price gouging, there's some price gouging that is going on over there in Texas.
Welcome anymore. Clean out your house good, disinfect and sterilize. I've got my ceiling fan, the Mr. Sun, my.
You know they have the cold front, the cold. I don't even know what to call it. That freeze, that winter freeze.
Out to live, I know I'll stay alive. Hey, clean out your house good, disinfect.
Oh, thank you for that heads up there, Joy. Don't go to Portland and drink from the street water fountains. Yeah. So things to not do when visiting places like Portland, Oregon. Downtown Portland, if you ever come here, don't drink out of the street bubblers or the water fountains. What's that? Drinking during the day. Oh, so it's a drinking fountain at day and a butt washer at night. Okay. So are you saying that there are that many homeless people in downtown Portland, Oregon? That's how they live? Because I've heard stories about the homeless in places like San Francisco. But I've never seen it personally. So you're saying that in downtown Portland, Oregon, it's pretty much the same? And if that is the case, then how is it that people can be talking about third world countries the way they do? Yeah, you know who I'm talking about when I say people. The one that shall remain nameless. One that has no name. Doesn't deserve to be mentioned by name. Yeah, that one. Okay, so let me wrap this all up. And then we can go into musical therapy and actually chill out for the night. So here we are looking to break down the research somewhat. Anal swabbing and stool screening is not a new method of testing for COVID in China. Oh, it's just new to the news that is being tested that way. Since September 2020, CU Medicine has been providing 2,000 tests a day, including stool screening tests, free stool sample testing of children and select populations have been occurring since last March. It is hoped that this helps identify asymptomatic people carrying the COVID-19 virus as early as possible in order to stop its spread in our community, quote, end quote, CU Magazine's official said in a press release. The stool tests are focused on high-risk babies and young children, the pediatric population returning to Hong Kong from high-risk areas, and people who have difficulties collecting specimens of sputum, nasal swabs, and throat swabs. Stool specimens are more convenient, safe, and non-invasive to collect in the pediatric population and can give accurate results, say Paul K. Shuing Chan, chairman of the Department of Microbiology and associate director of the Center for Gut Microbial Research. Among the confirmed cases in the territory, we note that there is more than one COVID-19 patient who had stool test positive, while tests for respiratory samples were negative, added Francis K. Leung Chan, Dean of the Faculty of Medicine and Director of the Center for Gut Microbiota Research. But how many more? We have over 1,800 homeless just in the Portland metro area. Wow. Okay. Yeah, those numbers are high. In the very developed land of the free, home of opportunity, things we don't know about where we live, yeah? 3 patients from a sample of 15 showed active viral infection up to 6 days post-respiratory infection clearance at the beginning of the pandemic. Some countries, including the U.S. Food and Drug Administration, are... The U.S. Food and Drug Administration is not a country. Anyway, some countries, and including the U.S. Food and Drug Administration, are currently in contact with with us for details and arrangements of stool tests for COVID-19, according to the press release. Us who? Us, them people that doing the stool tests? So, what are the experts saying about this whole thing? They're saying that that report is false. Omai Garner, PhD and Associate Clinical Professor, Clinical Microbiology Section Chief, and Point of Care Testing Director in the Department of Pathology and Lab Medicine at UCLA Health. Garner told Healthline that at first he was surprised to see the report on anal swabbing being used to test for the disease. It's well established that the gold standard or best sample to take is something upper respiratory, he said. This was something that was looked at early on, in March, April, May timeframe. And it was found that the PCR positive signal that is found in the stool does not equate to live virus. Alright. Pause for one quick second. So, what is found in the stool does not equate live virus. What is found in the CT40 and CT45 PCR tests, that is a positive signal of a live virus? I'm confused. So, who is right? Who is wrong? Or is it a question of right and wrong and just that we don't understand what is happening? Somebody help me out here. Dr. Gary Prokop, MS, Medical Director and Co-Chair of the Cleveland Clinic's Enterprise Laboratory Stewardship Committee and Director of Molecular Microbiology, Virology, Mycology, and Parasitology, is currently responsible for COVID-19 testing at his facility. I think he has too many jobs. But he told Healthline that although the virus may be found in the stool, going to the focus of infection, that is the source, is preferred for specimen collection. Prokop says that at least one early study supports respiratory specimens as superior to the other end of the alimentary canal. I think we are far enough into this pandemic, and there's a substantial amount of data out there now saying that that is the best source if you're trying to figure out who has acute disease. Okay, so if you're going to argue source of the specimen, you're saying upper respiratory is the best way to get the specimen. All right. I am stuck on how you test the specimen. That's what I am stuck on. And do I have good reason to be stuck on that? Well, I guess we'll find out. We have a call coming in here. Hello. Good evening.
Hello.
Hi.
Good evening. Good night. I'm actually on the road heading home, and I was told not to text and drive, and it's late. I cannot pull over to post my messages in the chat room. So I'm just like, I had to call because I caught the last 10 minutes of the discussion or of the information that you provided.
Yeah.
And I just wanted to just put my, not even 1.5 cents in.
Okay, go for it. Because, you have permission to say all that is on your mind.
Oh, dear. Oh, how much time we got? Oh, boy, it's almost it's almost, yeah, I'm looking forward to musical therapy tonight. So I'm just wanted to. Doing testing based on either an anal swab or fecal matter. Isn't that the waste that comes out of your body? So how can that be used to test whether an individual is positive for this virus?
Well,
based on the waste that is coming out of their body.
Basically, they're saying that because of the virus's effect on ACE inhibitors, ACE2 receptors, which happen to be prevalent in the gut, they're saying that at the end of it all, people have been tested through the nose and throat and tested negative, but then they test the stool and they test positive.
Hence why I'm calling in. Is it when it comes out the other end, isn't that the waste that is being excreted from your body?
Yeah.
So does that mean that it's still in your body when it's coming out through your waste?
Well, apparently they're saying that it is. What the argument is, no, with the last bit of information that I read, is that they cannot say definitively if it is a live virus.
Thank you. That's the reason I'm calling in.
So,
like you, I am not trying to satisfy your hunger. I am just trying to stimulate the appetite.
Right. So here we are. My question is, regardless of where you take the specimen from, how do you test it? What is the good method? Because they're saying that the RT-PCR tests, because of the CT, the cycle threshold, then the information that we're getting is scientifically unjustified or unjustifiable.
If I may say something, as an individual who, and that's one of the reasons I'm calling in is because according to the guidelines and however you want to call it, I tested positive.
Mm-hmm.
And I am one of the asymptomatic individuals who tested positive because I exhibited no symptoms.
How many times did you test positive?
Well, I tested positive twice. Once with the rapid test, that I was told that sometimes the rapid test can yield a false positive. So I wanted to be sure. I went back and I did the so-called PCR.
Mm-hmm.
This is the one where they took a specimen of your brain because it literally felt like they touched your brain when they took that sample. I am not kidding. Have you ever had a COVID test?
No.
Okay, so when I tell you that PCR test, I'm thinking that maybe 2 or 3 hours, it still felt like they had that swab up in my nasal cavity. It went up so high.
Mm-mm.
So that one also came back positive.
Okay.
Still, no symptoms. Within a 5-week period, I wanted to be sure, so I went back and I got tested 3 more times within a 5-week period. Those last 3 tests did come back negative. Still no symptoms.
Mm-hmm.
They did throat swab and they did brain where they touched. They went up the nasal cavity.
I touched your brain.
I'm going to be serious now. Yeah, they literally introduced themselves to my brain. But I had 2 of those. I had 1 of the nasal one, and I had 2 throat swabs. And the last 3 tests that I took did yield a negative result.
Mm-hmm.
But my thing is, if they have so many different ways of testing for this virus, they have a vaccine for a virus that they have not figured out
how to test
a way.
for it.
Okay, so if we test for this virus with this way, 99.9% of the time it's going to come back positive. Who are we to believe if we go and we have a nasal swab, a throat swab, a blood test, or however? How are we supposed to trust the results from these tests
when there are so many, when you're getting conflicting information from all over the place, or incomplete information?
They haven't narrowed it down.
Right.
And that is what is blowing my mind.
So here's the thing, and this is just DJ Kevin Stew talking, and not DR, because I don't have that. So.
Oh, that's okay. I don't have a DR or a DJ before or after my name. I'm just a concerned citizen.
So here's the thing. Here's how I see it. If you have an agenda, you do what you need to do to push that agenda. Right?
True.
And I don't think anybody in the United States currently would say, well, I don't think that Big Brother, the government, has not done certain things to its citizens before. We know about the Tuskegee experiments. Right?
And that's what we know about. That is what we know about.
Right. So, if they've done it before, they can do it again. Can they do it on a larger scale? We don't know. I'm not saying that that's what they are doing. I'm just saying that they can do it. Now, if you're going to, if they're going to, say, have an agenda to push for a new vaccine to be fast-tracked and introduced to everybody for whatever reason, and they can push a pandemic, then why not do it? You get the objective met.
And when you say vaccine,
mm-hmm.
When I hear that, I take that with a grain of salt, because based on what I know, and I am in no way a medical professional,
mm-hmm.
but based on what I know about vaccines, you can't develop a vaccine in the middle of, and I'm using this word very lightly, in the middle of a pandemic and claiming that it is working. Because you have nothing. You can't even figure out a definitive way
to test for the
to make sure to test for the virus. So how in God's name can you develop a vaccine when you don't know what the real results are from this so-called pandemic?
Well, apparently you don't really need to know. You just need to have enough people scared enough that they are begging for the vaccine. Apparently that's all you need to know.
You know what? I need to know.
Well, you're one out of how many million people? Am I going to do what?
I don't care about a million people. I care about me.
You asked me.
You want to take the vaccine?
Take it where? Where does it need to go?
To hell?
Oh, I'm not ready to go there yet. So, no, I won't be taking it.
Just asking. No, but it's like, yes, there are. I can only speak for me. I am not speaking of the millions of people in this country who are scared out of their wits about a pandemic that is or isn't a pandemic. During a pandemic, why are there so many medical professionals out of work if it's a true pandemic? Don't they need all these medical professionals to be at work to fight a pandemic?
Mm-hmm. You would think so, right?
Okay. Yeah, I'm sorry. We're talking about vaccines and the way they were testing. I kind of digressed for a moment.
Yeah, it tends to happen on this particular show. It's just one of those things. This broadcast leads people to go down several rabbit holes. It's not just one, and so it's a whole network of rabbit holes once you get down into that first one.
Lord, it's scary down there. And now tonight's topic, from what it seems like, and I do apologize that I did miss the first part of the broadcast, but it sounds like they're coming up, or excuse me, let me not say they. Let me say the United States is now making it public of another way to test for a so-called virus that they've already developed. How many companies we have that have already developed a vaccine for a so-called virus that they have not been able to pin? How the hell can you develop a vaccine for something you have not pinned down?
Well, in their defense, this is not a new test by any indication of the information that I'm seeing here. Apparently, they have been doing this test for a while back in China. It's just that it's now coming out.
No, I'm saying the U.S. No, I heard that part. What you said about that they've been doing the test in China.
Yes.
But now, I think you and I live in the United States. Have we ever heard about this test being mentioned as even a possibility?
Well, that's just
a way to screen.
According to this report on healthline.com, they're saying, hey, this is not the way to go, these anal tests. And they're what it is now that I'm looking at is pretty much a breakdown of the data and what they're saying about it. Because according to Dr. Prokop, at least one early study supports respiratory specimens as superior to the other end of the alimentary canal. So basically, they're saying upper respiratory specimens are samples being used to test for the virus is the best way to go. My thing is, how are they testing it? I don't care where you want to pull it from. If you want to pull it from hair samples, whatever. How are you testing it? Because if you're gonna go with but if they're going with the PCR tests, they're using too many cycle thresholds for those results to be scientifically justifiable. So how are they testing these samples? I'm still stuck on that. I'll present the rest of the information, but I'll keep coming back to that.
And that is what. Listen, when I tell you, I had the 3 different tests done.
Mm-hmm.
The 3rd time I went for that test, I am like, this is a load of crap, because the other 2 times I went for this test, first, it was the swab, the nasal swab, where they just literally went at the base of your nostril.
Mm-hmm.
Then they went up and touched your brain.
Mm-hmm.
And then they swabbed the
back of your throat.
Yeah, the back of your throat. But the first time they did it, I literally couldn't feel anything. The second time I went for that throat swab, they went deeper.
Well, I had to go find something.
You know what? I am like.
But don't you feel so much better now that you have received these negative results and your mind is at ease?
No. I was never positive to begin with. The only reason I went for those tests is because I needed it to go back to work, and I needed to have a negative result so I could go back to my trainer and start working. I was never positive from day one.
Hey, listen. I don't even know what to say about them. Joy was saying that the vaccine is not a live version of the virus that they use for it. They use the outer shell, the protein. They identified a spike protein and they use that to develop mRNA virus. And I spoke about that a couple of weeks ago on this broadcast, how they had designed the virus, the vaccine. So you know, it's a different type of technology that is being applied to this. Uh, in Scotland, they have vaccinated everyone from the elderly down, and they are now in the 50s range in Scotland. Is it something that is working? Is it working? Are the numbers down because the vaccination works, or because no, they can't say that the vaccination doesn't work, so they have to bring down the numbers? I don't know. I really don't know. Is the virus real? I believe the virus is real.
Oh, yes, yes. That one thing I will not question, that the virus is real.
Right.
Is the flu virus real? How many strains of the flu virus do we have? How many thousands or hundreds of thousands of people die from the whichever strain of the flu virus that happens to be prevalent that particular year? How many hundreds of thousands of people die each year?
You're straying from the point, you're straying from the point. And I digress because you are opening up, you're going so deep into the rabbit hole, into the maze of the myriads of holes that is down there. The network.
This is my way of getting back, because they went up deep in my brain, so I'm going down deep in the rabbit hole, okay? Excuse me. Okay, yeah, I apologize. I couldn't. You just opened up. You just left yourself wide open for that.
Me?
I had to take advantage of that.
You see, I didn't do anything. I was just here. But I truly appreciate of you calling it and sharing with us. Thank you very much. And do get home safely.
Yes, I'm actually home safely. Just didn't want to create any background noise, so I am actually home. I parked and I got
nice.
About to turn off and listen to some reading musical therapy.
Well, I have 20 minutes left and a little bit more information to drop in there. I just need to finish giving this bit of information before I jump into musical therapy, But boy, talk about a much needed musical therapy. Yes, we do need it tonight. We do need it. If no other time, we do need it tonight. So, thank you much. I want a massage. I need a massage, just to let you know. I'm just tossing it out there.
Oh, you're not getting one tonight, sir. I apologize, but I need to go to work tomorrow, so you're not getting one massage tonight. We're going to have to do like everybody else does, and we'll schedule one for you.
Yes, ma'am. As soon as possible. You can just put me at the top of the list.
You're always at the top of my list.
See, that's what we're talking about right there. I thank you very much. I catch you later. Finish tuning in. I'm not done yet. Go and tune into the rest of the broadcast.
No, definitely no. Yeah, the only reason why the broadcast isn't going is because I'm on my phone and it cuts out once I make a call. But the moment I hang up,
you're back in it.
I am back.
Okay, cool. All right.
Good night and thank you.
You're very welcome. Good night. So, according to ProCorp, once again, at least one study supports respiratory specimens. And again, I say, okay, when you get the specimen, how are you testing it? Garner says, I think we're far enough into this pandemic, and there's substantial amount of data out there right now saying that that's the best source if you're trying to figure out who has acute disease. Right away, in the very early days of the pandemic, we were sending samples to the CDC for testing. They asked for lots of different samples. They'd ask for stool, they'd ask for urine, they'd ask for respiratory swabs, they'd ask for blood, because this question was still trying to be determined. What samples should we test, he said. But it became very apparent like most other respiratory viruses, the most acute place to find it is in the upper respiratory tract. So this is why I was a little bit surprised and confused by the reports coming out on large-scale anal swab testing. At the same time, Garner says he doesn't want to eliminate stool testing. Okay, so you don't want to remove it altogether, but you're saying, don't do it. Don't let that be the go-to, but don't take it out of the mix. He said, we do some stool testing here at UCLA, but it's in a very, very limited capacity. And I cannot think of a screening context in which anal swabbing or stool sample testing would be preferred. Wide-scale sewage screening at buildings is another story. If you ended up finding it in the sewage, that means somebody in the building is potentially infected. So that's a well-established and reasonable way to do surveillance on large groups of people without having them all swabbed. So if you can test it in the feces in the sewer, and that is going to give you a clear indication, why wouldn't an anal swab give you a clear indication, or a fecal test give you a clear indication? Am I the only one that those two don't quite add up? Anybody else caught that? I'm just checking to see if I'm looking into this all wrong. But again, it's information that is put out there. This one was on healthline.com. The information I brought to you at the beginning of the broadcast, that was from mercola.com. Y'all can check them out yourself. Read it again, ask different questions, take it from another angle, search for additional information. It's all up to you. Do your thing. I got nothing to tell you, but go ahead and find what you can find. Ask the questions that you need to ask, because again, my job, stimulate your appetite, not satisfy your hunger.
Music like this and music like that, and I break and take it back as Mama Sterling back to the top. Coming in hard, giving praises to the Lord. Sing it out, those Mama Sterling. Thank you, Lord, for what you've done for.
Through it all, though, we need to say thanks that we've gotten this far, that we can talk about these things.
Thank you, Lord, for every little thing.
This is Richard Stevens working out with Little Lenny and the late Yvonne Sterling.
What you've done for me. You touch my life with your blessing. Thank you, Lord, for what you're doing now, right now. Thank you, Lord, for every little thing. That's why you know I'm not stressing. Thank you, Lord, for another chance to sing. Make you tell anything them this. Them say that one of their door, the dash it way. Only for people gone to where I'm in there. You have your life and ambition. Still up on a mission, and now one more chance you are big out there. If each one help, one better must come. So when you get your blessing, along go share some. And when you see another man fall on the ground, lift him up, no bother keep him down. Mama Sterling sing. Thank you, Lord, for what you've done for me. You touch my life with your blessing. Thank you, Lord, for what you're doing now, right now. Thank you, Lord, for every little thing. That's why you know I'm not stressing. Thank you, Lord, for another chance to sing.
So let me tell you something. Some people need a little food upon the table. I don't know where to find them. And you should give a little blessing if you're able. With humbleness behind it. No greater deed, no greater love. No better way to show it. There is no feeling like
you've done for me. Thank you, Lord, for what you're doing now, right now. Thank you, Lord, for every little thing. Yeah, yeah. Thank you, Lord, for another chance to sing. I'm gonna sing along, sing along.
When we feel it's too much pressure, just bring your love on in. Oh yeah, oh yeah. I know I've never been this way before. I can't believe I find myself wanting for more. And even though we are origin from different worlds, I can't control this thing I feel. I want you for my girl, and I'm the one who always needs the best things out of life. I visualize myself with 2 kids and wife. Heaven must have sent you here. You mean the world to me.
This tune is sexy, don't it?
You've got the kind of love I need to set my spirit free. Cause when we feel
it's called Bring Your Love On In.
It's too much pressure.
The sound of Glenn Washington. New music from him.
When we feel it's bubbling over, bring your love on in.
10 minutes to the top of the hour.
Do it, babe.
10 minutes before I get on out of here.
Don't ever let the feelings of mistrust hold you down. Just let me get inside, my love. We'll always be around. Girl, you know I love you down to the very ground. Got no time for someone else. This love is stable and sound. And every woman that I see got something new for me. There is no other to compare. You are my destiny. Take a look into yourself and tell me what you see. You'll see a place of perfect bliss reserved for you and me. But when we feel it's too much pressure, step your love on in. Oh yeah.
Yeah man, bring your love, bring it come.
We feel it's bubbling over. Bring your love on in. Do it, baby. Abracadabra. Add a little candlelight in the scent of your sweet perfume, girl. Hocus pocus. Now you're in the cute little dress that I like. Don't lose focus.
This is the big bad new tune from Lee Kelly.
Magic.
Yeah, that's what it's called, Magic.
Snap of a finger, girl. I'll perform a trick on you. Anything you want me.
I can do magic too, you know.
I can do magic. Girl, all you gotta do is
I can make certain things disappear.
a trick or two, baby.
Mind you, I can let them return, I can let them reappear, and you can put them on.
But I know just what you need, girl. You don't have to write it. Just looking at your body, I can't read. Yeah, you're giving me the eye, and it's making me want you back, girl. Turn around and guess what's in my hand? One snap of a finger, girl. I'll perform a trick on you. Anything you want me to do, yeah. Magic. All you gotta do is in the light. Baby, I can do magic. I make your home disappear. Out of nowhere. There's a room will appear. Next thing you know, it's you and me. Ooh, baby girl, still leave. Baby, see what I'm about to do. If all the wishes come through. Alright. This is something you should know. One snap of a finger, girl, I'll perform a trick on you. Anything you want me to do.
Compliments to you and the way you love me.
Zed Robinson.
Makes me wonder where you've been all my life.
It's called All My Life.
I wonder, is it for real, or I'm a dreamer, or I'm just hypnotized?
And I have to ask a question, where have you been all my life?
The moment I laid my eyes on you, I just knew you were the one for me. Yeah. I'm so thankful that we're no longer strangers. You mean the world to me. Where have you been, girl, all my life? Now that I found you, baby, will you stay for life?
5 minutes to go.
Where have you been, girl?
I want to thank each and everyone for tuning in, for sharing, for commenting.
Please stay with me,
Thank you for that information, Joy.
pretty baby. Most of our friends,
I'll go read it and get traumatized in a moment.
they can't believe it's true. I'm with you. Yeah. What they don't know is the way I feel about you. And the way that you're loving me too. Where have you been, girl, all my life? Now that I found you, baby, will you stay for life? Where have you been, girl, all my life? Won't you please stay with me for life? Sunshine, moonlight.
You could hear her providing supporting vocals in the previous track with Ed Robinson. Here she is working out with Peter G. It's Jonah Marie. Zona Kirk Davis. You know him as Little Kirk. Check it's called That's the Way Love Goes. Yeah man, I needed this kind of a easygoing musical therapy to get me back into the easy wind down mode, you know? 2 minutes to the top of the hour. I got to tell you guys thank you once again. Remember, look out for members of your community. And your community is not just a development that you live in, but it spreads far and wide. The people you pass on the bus, on the plane, on the boat, on the train, these are members of your community, whether you walk, ride, or drive. Look out for one of them today. You never know who's gonna look out for you tomorrow. Thank you all. My name is DJ Kevin Stew. Good morning, good afternoon, good day to you. We'll do it all again tomorrow to close out the night shift week with Real Talk Wednesday, Marlon's favorite night shift show. Until then, y'all take care and be safe. Or I should say, keep a step ahead. Greetings and salutations, one and all. You're invited to tune in to the night shift with DJ Kevin Stew. It airs on Mondays with Community and Finance, Tuesdays with Healthy Love, and Wednesdays with Real Talk from 10 p.m. to midnight Eastern Time. Come spend some time interacting in the stew pot where we keep things bubbling and wind down in musical therapy. The night shift with DJ Kevin Stew is on kevinstew.com, where you're encouraged to have acceptance through enlightenment.